Hi guys, good afternoon and happy Sunday to you all. I have the pleasure today of hosting a fabulous guest today. So we are having the wonderful Dr. Mariam Zamani, who will be joining me live this afternoon. Hi guys, I hope you're well. You're very welcome. Thank you for joining us at Stories Hosts. Hi guys. You're very welcome. We have the wonderful Dr. Mariam Zamani joining me today. And from most of you will know her from her brand MZSKIN or MZSKIN from whatever part of the globe that you are from. Hi guys, you're welcome. Thanks for joining us this afternoon. We are just waiting for Dr. Mariam Zamani to come and join us and tell us a little bit about her story. As a lot of you know, I am passionate about hearing people's stories, and we've been running a series called Stories Hosts, and today we're having the wonderful Mariam join us. Dr. Mariam Zamani. Hi guys, you're welcome. Happy Sunday afternoon. I hope you're well. Hi guys, you're welcome. Just waiting for Mariam to join. Good afternoon. Hope you're all well. Hi guys. Hi there. How are you doing? We are just waiting for the wonderful Dr. Mariam Zamani to join me and to tell me a little bit about her story and a little bit about her brand, MZSKIN. So guys, we are just waiting and we have her here joining. So let's accept. Good afternoon, everybody. Hi guys, it's all a bit slow today. Let me see. So Mariam, I can see you, but I have accepted your request, but let me do it again. Let's see. Hi guys, you're very welcome. Just trying to get Mariam on with us this afternoon. Hi guys. I am going to send you an invite, Mariam, because for some reason when I'm hitting accept, it's actually not accepting. Good afternoon. Hope you're all doing well. Just waiting for Dr. Zamani. Mariam, it's saying that it is on, you're unable to join. Let me see why. Let's see. Okay.
Yay, we did it.
Yes, we finally got it. It's always the way, isn't it?
Oh my God. It's crazy.
I know, but lovely to see you on this lovely Sunday afternoon.
Gorgeous Sunday afternoon. Thank you for having me.
And you know what, Mariam, if you're okay, can I do a little opening line about you?
Absolutely.
Just for our followers, everybody will know who you are, and but I just want to really try and put it together in a little bit of a nutshell how fabulous you are. So Dr. Mariam Zamani is a global leading aesthetic doctor and an oculoplastic surgeon based in London. Clients fly in from all over the world, ranging from A-list celebrities and high-profile dignitaries. Owing to her extensive experience in oculoplastic surgery and skin rejuvenation, Dr. Zamani is known as the eye doctor. She is a pioneering woman in high-performance skincare and prides herself in less is more. So, Mariam, did that sum it all up in a nutshell?
Thank you so much. Yes, the words were too kind. Thank you.
So tell us a little bit about yourself for our followers.
So basically, I am an oculoplastic surgeon, which means I concentrate mainly on the eyes, the eyebrows, and the periorbital area. I'm double board certified, so I'm board certified in the US, and I also am the specialist registrar here in the UK. So I've done lots of training, and excuse me, I have a special interest in facial aesthetics. So I do a lot of non-surgical rejuvenation as well, including dermal fillers, as well as lasers and other energy-based modalities. And of course, I love eyelid surgery, which is what I do often. And I relocated to the UK, gosh, I think 16 years ago, started my practice on Sloane Street about 9 years ago, and have started my own practice now on the King's Road, off the King's Road, last September. I also am, the founder of MZSKIN, and also a co-host of the Guinea Pig podcast. So doing lots of really fun things. I love to have a holistic approach in terms of evaluating the face and what we may or may not want to do for tweaks.
Oh my goodness. I mean, I have so many questions for you. And it's just to have you here just explaining. I am an avid follower of yours. I've had the delight of meeting you as well at a lovely event that we had. And I think it's amazing what you do. And thank you for explaining a little bit about oculoplastic, because I was going to say, what is it? Could you share? I know what it is because I watch what you do, but actually I wanted to share. So thank you for covering that for me. So tell me, was it something that you always grew up wanting to do? Had you always got a passion in doing aesthetics or becoming a doctor?
So I am the eldest of four, born to two doctors, a surgeon and a pathologist. And I think it was always in my DNA to go into medicine. I was, initially I liked plastic surgery because of a series of events. So when I was a medical student, one of the classmates a year above me, his father had started Operation Smile, which is basically plastic surgeons who go around the world teaching and correcting cleft lip and palates in babies and young children. And, I got involved with that early on, did a bike ride, and was fortunate enough to have raised a lot of money for them. And they kindly took me on a mission to Thailand. And I think that was really eye-opening for me. I loved the fact that, a small surgery had such a large impact on the people that we were treating. I mean, I wasn't operating then. I was lucky if I got to close up a couple stitches at the end, but it was really, truly life-changing for me. And thereafter, I thought about going into plastics, and I really wanted to focus. I wanted to be an expert in one thing rather than a jack of all trades. And so I went into ophthalmology, always knowing that I was going to go down the plastics route. So while I'm an ophthalmologist, I'm board certified for that. I actually don't do any general ophthalmology, and I really do the reconstructive and aesthetic portion of that in terms of eyelids, skin cancers, reconstructions, and of course, all the aesthetic stuff. And, the fun part is that it's a very new and fast evolving subspecialty, essentially using all the non-surgical modalities. And so you don't have much training in that in the US or the UK, just in normal medical training. And so for me, I started using dermal fillers in patients that had so many surgeries from either trauma or a skin cancer, and they just didn't want to have the 50th surgery. And we were looking for different options in terms of what we could do in order to better make them feel more like themselves and happier with their appearance. And I started playing with hyaluronic acid, and that's how my journey with dermal fillers and the whole non-aesthetic started happening. And I think everything is an evolution. So that got me interested in the dermal fillers. Then I was like, you know what, if you don't have good skin, it doesn't matter how much surgery or how much, other injectables you do, you have to improve the quality of the skin. So I did some dermatology as well. And then finally, I wanted to learn all the energy-based systems. So I feel that my career is always a work in progress. I'm always learning. Today I was at a conference speaking about facial rejuvenation and eyelid rejuvenation. And I just think it's really fascinating. I think it's lovely and wonderful to have a number of different things that we can do to really help people achieve the best version of themselves, for more confidence, for, when they look in the mirror being like, oh, I feel like I look, I feel just better. So yeah, it's been fun.
I love the way you say you're giving people the best of themselves. You're not changing anybody, or people aren't coming to you wanting transformed into somebody else. You're actually doing the best of their own face. And I think that's absolutely amazing.
You know, you can be your best at any age. It doesn't matter if you're 20 or my eldest patient, I think, was 93.
Wow.
So, I mean, you know, it's, you always want to look and feel and live your best life at any age. And that's the whole goal.
Yeah, absolutely. So you talked about relocating to the UK, what, 15, 16 years ago. So where were you? You studied in
Washington, D.C. And then I moved here for my husband.
Yeah.
London is home. I love it here so much. I feel like, you know, every time I go away, I'd love coming back, because especially on these gorgeous sunny days that we're having right now, it's the best place in the world.
Absolutely. So you do have a practice, you still practice in the US as well, is that correct?
I don't. I'm still board certified and I hold licenses in a number of different states, but no, I haven't practiced there since I've moved to the UK.
Yeah. So I wanted to ask you a little bit about your consultation that you do with people. And what I find really fabulous about that, you talk about the expert eye. You sit and you watch somebody and you see everything move together. Could you talk to me a little bit about that? So what does that entail? Because obviously people will come to you and they'll say, I want this tweaked or I want that. But you take the whole faces as one, don't you?
I do, but you know, for me, the most important part of the consultation is, one, obviously what you said before. So being able to actually see people in dynamic movement. So oftentimes people, when they're looking at themselves in a mirror, they're looking at a static reflection of themselves as opposed to an animated version of themselves. And so I think that's very important to see how everything moves. People don't even realize that I'm analyzing them just by talking to them.
Yeah.
Most important part of my consultation has always been to ask them what bothers them about themselves. So, you know, my goal is not to bring out something that I might notice, but to help them improve something that bothers them. So most people who come in, they say, oh, you know, I look tired. They might not know what they need, or they may think they need one thing, but in actuality, I can explain to them, depending on what it is they actually are not happy with, or what reason that's brought them into my office. So most people who come into my office are there because they want to have something improved. And so for me, asking them, you know, what is the thing that bothers you the most? And then I also love to ask, what's the one attribute that you love about yourself? So some people say it's my eyes, other people say it's my cheekbones, some people say it's my hair. And the whole purpose is to really get their confidence and happy with how they're looking in terms of what their best attributes are and what makes them feel confident when they go home and they're getting ready, or, you know, they get up in the morning.
Yeah, it must be really rewarding actually to be able to be in, you know, especially when you work with people with cancers and cleft lip, etc. at the beginning. It must be very rewarding to be able to help people like that at the beginning of your career. And also now seeing people coming in and being very unhappy maybe with something, you know, whether it's through trauma or whether it's just they want to have the better self themselves and their better face, really. So I am totally intrigued. On your Instagram, you actually do a little bit of filming on your surgeries.
I do.
So it's really brave of you to do that, but it's really, I find it really intriguing. Because what was the thought pattern behind that? Was it because you wanted to really let people realize that this isn't very invasive, or what was your idea behind filming them?
So the reason, I mean, I don't film everybody. A lot of people don't like to be filmed, but I try to at least film one of my, you know, 3 cases that I have a week, 3 to 5 cases. And so basically the idea behind it is to demystify and educate people. Most people, they're terrified. They would be more willing to have, you know, a body procedure than their face, because 1, they're worried about pain, and 2, they're worried about what it entails. They're always scared something's going to happen to their vision. And so I try to show exactly what I do, that you can see, and it's a little bit demystified. Of course, it grosses some people out, and I always do get a comment, will you put beware? And even though I don't put beware, I do usually say happy Tuesday, I'm off today. But I think don't listen to it. They just are looking at the pictures. So the reason I did that is really to show exactly what I'm doing. And I think Instagram while it has many faults, one of the best things about it is that it can be very informative. There's a lot of misinformation out there, but at the same time, there is a lot of sources of very good information. And so the whole point is to educate people, to explain what I'm doing, and then for them to understand, you know, why you have skin and you have a little bit of fat, or, you know, what the surgeries are actually doing. So I love being able to video them. Like I said, not everybody allows me, even though it's very hard to actually identify anybody on the operating table, and I usually am very zoomed in, but that was the idea behind it. It's really to demystify it and take people through the journey so that they don't feel so apprehensive, because fear is the biggest, you know, thing.
Yeah, and it is amazing because you can actually do it under local anesthetic.
Absolutely.
So somebody can be in with you and out again, what, within an hour or?
Yes, so usually they come an hour before surgery just to make sure they're there. They change, we do some nice markings, they meet other people from the team, and then we take them back. And then, you know, the surgery, depending on whether it's upper and lower eyelids or, you know, one or a combination, sometimes I combine a laser with them. But, you know, about an hour or so, they're in. And then if they've had a local anesthetic, you know, as soon as they feel ready to go, they're allowed to go. Of course, had eyelid surgery, so you know you need somebody to drive you or have car arranged, because you can't really you know drive a car after surgery. And then if you've actually done sedation or even a light general, even in those patients, they stay about an hour and a half, 2 hours later. Anesthesia is really, I work with a really lovely team and very quick to recover, and they're out of there in a couple of hours. So most people are there between, you know, 2 and 4 hours.
Yeah, brilliant. And it is amazing. And I think anybody who is apprehensive, it's a great way to be able to see and trust you. And you are known as the eye doctor. You know, as I said, you have people coming globally to you for this. So it is amazing. And I love seeing it. So don't stop. I don't find it quite gross. I actually find it really interesting. So can we touch a little bit on your skincare? So MZSKIN is truly science-backed beauty line, isn't that correct? And I know for me, when I'm buying skincare, it is important when you know that it is science-backed. And it's really important to me also when I know that there is, you know, there's a doctor and a professional behind it. So what did you see a gap in the market for when, because obviously you were a surgeon first, and was this something that naturally carried on, or was it something that you saw, I see a gap in the market and I want to bring something to fill that gap?
I think I always say everything happens for a reason. I did not embark on this with a big, you know, plan. I didn't have, you know, I didn't know what I was getting myself into. So originally it started because I suffer from melasma after my second child, and pigmentation was something that really always bothered me. And for me, when I was younger, skincare was always, and still is obviously, a very big part of my nightly ritual and my morning ritual. And for me, I really wanted to use ingredients and products that worked well to give me the best, healthy, glowing, radiant skin. When I was younger, I was spending oodles of money on, you know, all these brands we all know, love. And then as I got more educated and I graduated from, you know, medical school, did my training, I realized while they're fabulous, they feel lovely, and they can even make you have like a nice temporary glow, they may not have had the ingredients that I needed in order to keep my skin clear from pigmentation. So I started using doctor-led brands. They were all made by men at the time, and I felt very medicinal. I lost that luxury feeling and that sensory component of it that I enjoyed so much as part of my own ritual in the evening. And so I went back to, you know, back then it was Shiseido. I loved that brand. And so I started using the Shiseido, and I worked with the formulator to create a new combination, and I'd use them in combination. And my husband said, why don't you just put them together, make your own? And, you know, you might give it to a couple of patients. I had no intention or any idea of where that would lead me. Next thing you know, I had, you know, the ear of a beauty buyer from Harrods who said, you know, there's only one other doctor-led female brand on the market. There's a lot by estheticians, nurses, facialists, but none by female doctors except one other. And they really were like, we want to launch you. And so for me, that was something that was really, you know, a Cinderella moment. I didn't exactly know what I was stepping into. And now 5 years later, we have a number of different products. We're on almost every continent in the world, 90 retailers, 90 plus retailers. And it's just gone from strength to strength because I think it resonates with the, person who's buying it. So they want efficacious, results driven, medically backed, scientifically trialed, good ingredients that work well synergistically to give them beautiful, glowing, and healthy skin. And so the idea was never to have too many different products, but a core few products that you could do quickly, but made you feel beautiful, and you would see the long-term results of it. So that's where it was embedded. 3 principles to reveal, enhance, and protect skin, which I think is really important for anybody doing any skincare, and also a complement to anything that you do in the office. So, you need to have the foundation. The skin is the foundation, and everything else you do is secondary to making sure that your skin is optimized. So I think it was a natural progression into the more holistic approach of maintaining and pro-aging.
Amazing, and congratulations at the way the brand, how it is actually growing and expanded across the globe. It's truly amazing. And what I love was a quote from you saying that truly understanding the actives and how they react to your skin is imperative in formulating powerful results. And I love that because it is, when you buy it and you put it on the skin, and you're obviously a woman and a female, and you put it on the skin, that product's going to do powerful things. And I love that. And obviously that's your unique point of difference as well, being a female-led brand as well. So a little bit about your clinic, and congratulations, you've got 2 clinics now, is that right?
No, I just have the one. I operate out of one, but that's
okay.
And then I have my own clinic off the King's Road.
And did you launch that? Was it pre-lockdown or was that?
No, I just launched it in September. It hasn't been a whole year. It's about 8 months. It's been fabulous.
Yeah. I remember you doing a lovely live and video around it at the time, and it looks absolutely gorgeous. So it offers a wide range of treatments for all ages and concerns of skin. Is there anything that you can share with us that you're using at the moment that's relatively new, or it's been on the market for a while but you're seeing incredible results with at the moment?
So I love using all of my technologies and all of my arsenal for, a multifaceted approach. So one from skin to volumization. So I love all the dermal fillers. We have seen a boost in skin boosters in general. There's so many new ones on the market that help to rehydrate and promote collagen induction without causing volumization. So a lot of people, we've seen a lot of overfilled faces. We can all, we all know that friend who may have gone a little bit too far. And so the nice thing about these, new dermal skin boosters is that they allow for improvement in skin texture, tone, and hydration without causing that volume. So I'm seeing amazing results on the face and the body, as well as the neck and the décolletage. I like combining that with some dermal fillers that may or may not be diluted to give skin a little bit of more density. And of course, my energy-based system. So I have a new Sciton BBL Halo machine, which is a platform machine for laser resurfacing, both fractional and fully ablative. Fractional means you're only getting rid of some of the skin at one time, and ablative means you're taking away the whole top layer of the skin. And I really love these treatment modalities in combination with the other things that we are using. And of course, we have the new M-Sculpt Neo, which is just a fabulous way to tighten and skin, as well as improve muscle tone and burn fat. I mean, it's the dream.
Yeah, so I have seen the effects of the Halo, is that correct? And I think I've seen you doing some of Skin Live as well. Is there a lot of downtime with that, or do you find that, because it quite marks the skin, doesn't it, immediately?
So when you use a fractional or fully ablative laser, you will absolutely have downtime. It can be as light as 3 days. It could be as heavy as 2 weeks. And in some instances, if it's really fully ablative, sometimes when I do a surgery, that can be even a whole month. So there's a whole range, and it's really tailored to each individual patient who comes in. I love doing a lot of those lasers in the fall and the winter. Now that we're getting closer to summer, especially living in a place like the UK, where we don't have so much sun exposure the rest of the year, and the sun comes out, all you want to do is be outside. So, obviously you don't want to expose that beautiful brand new skin to the dangerous effects of the UVA and UVB rays.
Absolutely. Yeah.
I think I save a lot of things because, as I said, a lot of my patients don't like to be photographed or to have the process go through. So whenever I do something on myself, I always post it.
Yeah, yeah, excellent. So you spoke a little bit about your podcast that you co-founded with Fiona Golfer, isn't that correct? Called The Guinea Pig. So I find them really great. They're so good. Why did you start to do that, or what was the idea behind it?
So we started that before lockdown, and we took a little hiatus because of lockdown, and we're just about to relaunch. But the idea behind the podcast was really to demystify and educate people about different treatment options and modalities, and have an expert every show discuss a treatment, have Fiona, our resident in-house guinea pig, try all the treatments, and then me as a doctor being able to explain some of the technologies and also explain and educate what questions we should ask. Because sometimes, you know, you go to a doctor and they tell you all this great stuff, but you don't actually know what the right questions are to ask, you know, so that you are not dissatisfied afterwards. So the idea behind, you know, having a happy outcome, happy patient, a happy treatment procedure, whatever it is that you're having done, is really knowing the facts so that you can make a good informed decision. So there can always be a surprise here and there every once in a while, but for the most part, if you know what to expect and how the process is going to be and what questions to ask, you feel much more relaxed, and also you end up having a better outcome.
Yeah, no, it is amazing, and it's great that they're starting up again, because I think for people to, you know, who are maybe nervous and they're coming for appointments, and as you say, they don't know what to ask, and for the fact that they can listen to these podcasts and be really informed and feel empowered to actually ask and not feel silly asking something. So I'm really looking forward to seeing that up and running again.
No, so by the way, never ever a silly question. Any question that you have, regardless of what you think the doctor might say, it's very important for you to express it.
Yeah, no, that's good to know. So you share a little bit about your fitness regime as well on your Instagram, which again I love, because I'm always fascinated with people's fitness and how they fit it in to a very busy schedule. But your fitness is amazing, and I mean, I've said to you before, I just love watching, and it actually, if I've had a bad day and a busy day, it actually makes me want to actually just go and pull out some weights and do something. So you're really encouraging and inspirational by sharing that. But you recently shared a little bit of a health scare that you had.
Yeah.
Can you share a little bit about that with us?
So basically, unfortunately, I had a issue after having I'm pro-vaccine. So just to say that up front, I had a slight issue that happened after my second COVID vaccine, where I had inflammation and fluid that had formed around my heart. And I found out with my trainer, you know, I was training, I had the vaccine, I had gotten sick, you know, coincidence or, you know, for whatever reason, I did have a little bit of, I was unwell. Then I went to California for Easter last year and I didn't exercise to the same stamina that I did in the UK. And I was, you know, busy doing meetings and work with the UK at the same time. So I thought I was just tired because I was jet lagged. And I started training. And my trainer was like, you know, your heart rate is going crazy high, despite the fact that we're much, you know, in terms of difficulty. And so I had it evaluated, and I had a cardiac MRI that showed this fluid and inflammation around the heart. I went on medication for about 4 months, had to keep my heart rate less than 120, and also, you know, no alcohol during that time, really rest as much as I could. And fortunately, after the 4 months, I had my repeat scan, and I've just recently had another one. All is good despite no longer being on medication. But yes, you know, health is wealth. If you don't have that, then you have nothing. And I feel fortunate that I'm in tune with my body, and I have people around me who also help me keep that in check.
Yeah, no, and that's fantastic that you've had the all clear again. And it's brilliant because health, as you say, fitness, it's so important. And I would say probably with yourself leaning over people, surgery quite a bit, it can be quite hard in the shoulders and the back. But no, you're very inspirational by sharing it, and I do love it. And it's great that these things can be done in our own homes as well.
Absolutely. I wanted to show people that if I can do it, and I'm not like some, you know, athlete or any by any stretch of the imagination, but if I can do it, then anybody can do it. And I think one of the reasons I started was actually because my trainer was like, oh my God, I cannot get you off your gadget. I'm going to video you so that you can't actually use the phone. And then I put it on. And every time I put a workout on there, I get comments, oh, you inspired me. I started working out because of you. And that makes me so happy. If seeing me make a little bit of a fool of myself, can get somebody off the couch and get them moving, then I'm very happy with that.
Absolutely. And I love the mat that you use with the sliders, because I do a lot of reformer Pilates.
Love
and it's been really great for me for my health with having back surgeries and stuff. But because those movements are very, very similar. And the fact that I'm sure you can just pack that up with you and take it wherever you're going.
So nice. Those sliders can be used on any, you can get sliders for the carpet even. So you can find sliders for really any floor.
Yeah, no, it's incredible.
Take with you, but the sliders you can take anywhere.
Yeah, no, that's great. And also, so if we were talking to our younger followers today and they did not know where to start with skincare, and they're a bit overwhelmed because there's so many products out there in the market at the moment, what would you suggest to the younger person following us today and listening to this?
Great
in
question.
terms of their skincare? Yeah.
So first I would say be consistent. So find a simple skincare routine to reveal, enhance, and protect. So reveal. Invest in a good cleanser. There are some great ones outside of MZSKIN too, for different budgets that you can use to really cleanse the skin, remove any dead skin, makeup, pollutants that sit on top, which will give you a nice clean canvas so that any actives that you put on top will then have the best penetration and therefore efficacy. So one is to reveal your beautiful skin. Next is to enhance it with topical actives. For me, I think there's a few ingredients that if we use, then we're pretty much good as gold. This depends on different skin types. Now, for me, I love things that are rich in ceramides, peptides, hyaluronic acid, stem cells, whether they're animal or plant-based, as well as retinols, vitamin C's, antioxidants. So I think it's really important, to enhance the skin with these topicals, and then protect the skin. And again, that's with antioxidants, different skincare topicals, as well as SPF. Rain or shine, those UVA rays are coming through regardless of whether you see the sun. That can cause premature aging, fine lines, wrinkles, sunspots, and of course the dreaded skin cancer. So really important for you to wear SPF all year round, and reapplying that if you're in the sun. So if I were telling somebody, where to start, I would say those are 3 pillars. You don't need a lot of skincare products, but you need a good cleanser. I would say invest in a good serum and or moisturizer, and then finally an SPF. And so for me, the holy triad is really a vitamin C, a topical retinol or retinoid, and SPF. So if you have those 3 in your armoire of skincare, you are already ahead of the curve. And start young. Don't wait.
And in terms of aesthetics for younger people as well, I'm talking adults, not, under 18s, but so would you suggest that they would start with some maybe lasers or some sort of a skin aesthetics care as well at the same time with their skin line?
So I think there's late to start. I think in young people, the most important is to just stimulate collagen production and do very light treatment. Do not need to be aggressive when you're younger. You can use them in your 30s, 40s onward. If you're in your 20s, start with things like, instead of having facials are lovely, and there's a place for facials and everything, the kinds that are given in a spa, for instance. But if they make you feel good and they de-stress you and they're giving you added benefit for other reasons, then absolutely go get them. But don't necessarily use them as a way to, give your skin optimal, because you're just doing that for one day. When you wash it all off the next day, none of those actives will be there. And, that's all something that you need to know. If you want something that's going to improve your skin health, then yes, go in for light microneedling, go in for LED treatments, go in for a nice hydrofacial if you want a facial that'll really deep cleanse your skin without being irritating. If you have pigmentation, you can tackle that with different light treatments. So there's a lot of things that you can start when you're younger. And then as you get older, I think, quarterly, if you do one treatment, it doesn't have to be strong, but you can do one treatment a quarter and you can really maintain your skin in the best possible way.
Fabulous. That's great advice. And also in terms of the men and women of a certain age, a little bit about like myself, to over 50. What is good to maintain skin for over 50s and also reversing the signs of aging? What would you suggest?
And so unfortunately, the late 40s and 50s are generally when people are going through hormonal changes. Women have it sort of a little bit difficult. You start your cycle in your teens, and then you only sort of stabilize in your 20s, and then all of a sudden you're having babies in your 20s, 30s, 40s, whatever it is for you, maybe not. And then all of a sudden, once you're done with that upheaval, you're going through, hormonal changes with menopause. There's always a factor of hormones that plays into the skin. I would say, depending on where you are and what you want to do, hormone replacement may be a good adjunct to skincare routine. Make sure you follow the holy triad of skincare: reveal, enhance, and protect, I think is very important. And then combining that with office procedures. So, every once in a while, again, I don't think you need to come in all the time, but having, or some people love to have little treatments often, so they might want to come every 4 to 6 weeks and have lighter treatments done. Other people don't have that kind of time for maintenance or even the budget, so they come every quarter, and you can really tailor it. I think as we get older, we see the signs of our misspent youth. So whether it's sun, environmental factors, smoking, drinking when you were younger, lack of sleep from lots of different reasons, from professional to family, stress. There's a lot of things that can start showing on our face. And so I think for everybody, having light treatments is a very nice way to help improve pigmentation. If you're somebody who suffers from redness, rosacea, having a laser once or twice a year to help keep the blood vessels at bay is a nice thing to do. And slightly stronger, maybe one treatment a year where you're having, something like a halo or something like an ablative laser to really retexturize the skin and jumpstart that body to make collagen again. So, and if you feel that you need more tightening, then there's something more than that. So something like a Morpheus 8 or an alt therapy that's using energy to tighten the skin and really give you, a better quality and health of the skin. And of course, at a certain point, our scaffolding changes as we age. So, when they say your bone density changes, and it's really important to have calcium and vitamin D, but we lose bone volume in our face all the time as well as collagen. So if you are losing bone and you still have the same amount of skin, you're going to have a sag. And at a certain point, we can help that with in-office treatments. But then, later on, it may be that you need a little bit of that skin removed. And so I generally say if you have more than 1.5 inches or so of skin on the lower part of your face, then we can do treatments in the office, but you're not going to get the result that you get with a surgical procedure done. So I think it's very depending on, and some people age beautifully. Some people have no jowling and they have, a very wrinkly neck or something like that. Or, it's a lot of reasons why some people age differently than others. And so it's really finding someone that you trust, not jumping around, don't have too many things happening at the same time. I think it's really important to stay with somebody that you really like, because then they know what's been done. First of all, you're not mixing things that may not work well together. And second of all, that doctor knows your face. So hopefully if you have a good doctor, they will not overfill you, or, they'll do the thing that's the best in your interest because they know what you look like and what your starting point is. And again, I love pictures. I take photographs of every patient who walks in and has treatment, maybe not for neuromodulators like Botox, but for other treatments, all other treatments I do. And I think it's just really important not to overdo it. Sometimes we get a good result and we're like, that looks fab. And then we think, oh, if we do more of it, we're going to look even better. But That's not always true. There is a definite curve, and then it plateaus, and then it goes back down. So keep it little. I think consistency is the most important. Like anything, you get the best results when you have a routine that you are consistent with.
That's amazing. And it really goes back to everything that we were saying earlier about little, and often, but also having that relationship with your doctor and, you know, going through that journey. I think it's amazing to be able to have that, and for you to be able to journey with people, and they build that trust with you. So I suppose that really follows on to what I wanted to say about the Wellness Toolkit. You spoke a little bit about it on Share Lux lately. So what is that? Is that something similar that we were talking about?
Yes, you know, it's really, I think now we all want to live our best life for as long as possible. You know, when I remember thinking my mom was 50, I thought she was fabulous, but wow, that was a big number. Now I feel 50 is the new 40, and maybe that's just me trying to kid myself.
Yeah. No, I'm with you. I'm with you.
But, you know, we're living more vicariously, you know, so we're exploring, we're seeing, we're doing, we're watching. And I think the toolkit is to really help you maintain the best version of yourself. And sometimes we do need help. You know, life becomes a little bit of maintenance. You know, you don't buy a car and never have it tuned, you know, so the same thing, it comes with that. So for me, I do go on and off, you know, vitamins every so often. I have some that I'm consistently on, like calcium and vitamin D. And, you know, then there's a lot that I do like as well. So exercise for me is a form of meditation. I think everybody to have something in their life where they unwind and their brain can rest, because we are going, you know, 1,000 miles an hour all the time. I also, you know, put things in terms of diet, sleep. I think all of those things work synergistically together. So in order to look and feel your best, you really have to make lifestyle changes, and you can't do them all at once. So don't think, oh my God, I need to change everything and I need to be dramatic at the very beginning. Some days you'll be more successful than other days. And if you fall off the wagon, it's okay. You can always get back on and start over. Or, you know, every day is a new day. Every day is a new beginning. And it's never too late to incorporate wellness into your routine in whatever capacity you can.
Oh, that's amazing. And I love that, because it is so true. And I'm a great believer, just start somewhere, you know, just even if it's one change or something, you know, that you can do, it's important just to start that change of that wellness journey. So no, it's thank you for sharing that. And I have so much I would love to share or ask and talk to you about, and I know there's lots of comments coming up as well. So once we repost this video, I'm sure people will have lots of questions for you. But I always like to finish off with quick fire questions with my guests. So I have a few for you also. So first one is, if you had to choose 2 products to take to a desert island, one being an MZSKIN product, what would be the 2 things you would bring?
I would bring my Brighten and Perfect vitamin C, and I would bring sunblock. I mean, those are the 2 most important things. After all my problems with pigmentation, I can't leave home without those 2.
Yeah. And it's funny though, because we, you know, when I was young, there wasn't anything about SPF. There wasn't anything about protecting your skin.
I entropic, I mean, oil basically. Oh my God. If I could go back to my younger self, my mother used to tell me, I should have listened to my mother. It's Mother's Day in America. Little tribute to my mom out there, who used to say, you're destroying your skin. And I was like, I just want to be brown.
I know, it's crazy. It is crazy, because I am like you. I do have pigmentation from pregnancy. And when I do get a tan, I get it down my neck and up my face, and it just looks dirty. But that I know is because I sat out in the sun when I was pregnant also. So yes, it is important to take the SPF. Okay, so we did talk about, I was going to ask you about what you do to keep yourself centered and maintain strong values, but fitness, wellness,
is very important. I mean, everybody knows that if I haven't worked out and sleep, I'd say the 2 of those together, they're the most important things.
Yeah, no, fabulous. Best holiday destination?
I mean, every holiday. 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 I mean, every holiday as I go on a holiday, I'm like, this is the best. So I really, for me, my happy place is and has always been Saint-Tropez. So I absolutely love going there. I just love the colors. I love the feel. I love the sea. I just love everything about it. And also, I have just so many great memories for many years.
Yeah.
So love it.
Oh, I mean, south of France to me there's no other place like the south of France. It is glorious. And I mean, I obviously, I would work in a perfumery in Grasse and they also in Aise. And even just when you walk through the little towns and villages, you're transported to somewhere completely different, aren't you? It is just, there's nowhere else like it. It's beautiful.
I like it.
It is beautiful. So champagne or cocktails?
So I love this question because I love both, but we're getting into the summer spirit. Champagne and a piscine with lots of ice is my poison. Makes me happy.
Do we have a favorite champagne?
No.
Just whatever's going.
I'm a cheap date.
Yeah. So what is your best body treatment that you use?
So I love the Neo. It's my favorite things to do. So I think that's a really nice treatment. It's very pleasant. And I think in terms of having results, that's the one that I like the most.
Secret to happiness?
Having a smile. I think it's a mindset. If you have the right mindset, everything else works out well. So always think of life as half glass, as the glass half full. That's what I would say.
Oh, amazing. I love that. I might have to steal that from you. I love that. And also, I always like to finish up with just people sharing their scent story. You spoke a little bit about south of France there. And when you talked about, the colors and everything, the first thing I thought of, and the smells, smell can take us somewhere in an absolute instant. So have you a scent memory or a scent story that you would like to share with us? Something that just takes you to that special place.
So interestingly, I've only worn one scent my entire life, my entire adult life. From when I was 16, I used a Dolce & Gabbana red that is no longer around. It's been discontinued. I bought like the last three by accident when I was in Italy. I saw it and I was like, oh my God. And I use it so sparingly. Funny enough, my daughter, and now I finally found another scent that I love, and I love your number 2. And my daughter was like, I put it on before this live, and she's like, Mom, no one's going to smell you. I was like, you're right. But the funny thing is that scent makes you feel better, and it actually makes you feel pretty immediately. And there are a lot of different scents that take me back. If I smell something that smells like my mother, she has a combination of different Chanels that she uses, for instance, and I smell that and instantly I like that person because it smells like my mom. And, I always had this one scent. And so now, I think I finally found my replacement scent in number 2, but it's just so funny that, my husband too, if he goes away and I just have his pillow, I smell, everybody has their scent, and it's so important. It really can transport you anywhere. It can make you feel very happy. It only brings back happiness, by the way. In general, I don't really have a negative connotation with a scent. It's just one of those things that always makes you, it's like the sunshine. When are you ever unhappy with the sunshine? Never. So it's so powerful. And I like the idea. Now we're all, experimenting so much more, and there's so many more options out there. And now with all these, the ethical aspect of it, I love that you refill, for instance. That's just such a great way to help Mother Nature and Mother Earth. I also think in terms of the story, what a beautiful story. And I love your packaging so much. I love all your little side.
I know, because actually the first time we met, we hadn't gone down the sustainability route because we were launching, and we were, I just wanted to launch. But then, so we're only 3 years. We turned 3 in October past, but what I love is that we can look at the sustainability, and I love the fact that you're a clean brand and you're cruelty free and all that. It's just, it's amazing. And that's exactly what Story stands for also. So I couldn't wait to actually take it and share it with, you know, when I got the new packaging, I had to contact you and say, Mariam, you've got to look at this new packaging. So, but no, I love the fact that we both have very similar, you know, core values in our brands as well. And just really to finish up, I want to thank you and really thank everybody for joining us. There's been loads of questions that we haven't had time to answer because I wanted to fill so many questions in at the time I had with you. But we did launch a giveaway today together. We decided to collaborate, and we have a prize worth £690, which is amazing. And it's your Instant Radiance Kit. Isn't that correct?
Absolutely.
And then they will also win our Stories Deluxe Duo, which is our Stories #1 and #2 as well. So if you want to enter that, everything is on our grid, and you'll be able to follow MZSKIN, follow Stories Parfums, and like and share as many times as you want. And you can then win this wonderful Radiance Kit and perfumes. But Mariam, thank you so much for your time. I didn't realize you were speaking at a conference today either, so I'm sure you're ready to put your feet up and rest.
Go to the gym. I'm gonna go for a walk with my daughter, and then yes, I think that's my Sunday.
Yeah, and work out. But listen, thank you so much, and it's been a pleasure having you on with us on our Stories host.
Great rest of your Sunday.
And you too. You take care. Bye. Thank you.
Thank you.